I want to talk to you guys about why dentistry and specifically endodontics is called the arts and sciences of dentistry, or the arts and sciences of endodontics. This means that endo, or dentistry in general, and endo specifically because it's my field, my specialty, not only the arts, meaning that you have to have good hands, or in my case, good fingers, to create and be able to capture those nice white lines. But those white lines don't matter if the sciences are ignored. So the arts and sciences of dentistry, or the arts and sciences of endodontics, go hand in hand. You need to know the science before you can create those artistic dentistry. You need to be able to know what you're doing at every step of the procedure. It could be a crown prep, it could be an extraction, it could be endodontics. You need to know why you do what you do every step scientifically. I mean scientifically. You need to know why you're doing what you're doing scientifically. What's the scientific basis for what you're doing at every step? Now, why does this become important? Why is the arts and sciences of dentistry that go hand in hand together are important? If you're only good at the arts part and you're not very good at the sciences part, then you make a huge mistake. You misdiagnose, and I'm going to talk about a specific example in endodontics. But you misdiagnose and the patient will suffer. So you need to be able, you can create a beautiful, beautiful crown prep and go ahead and cement the crown, right? But if you didn't know that a crown prep could cause damage to the pulp, or beforehand you didn't take a PA, the sciences part, then your art sucks. Let's talk about a specific example that we had today. And again, my purpose is to teach. I'm not trying to put anybody down. But we have to talk about these things because, as I said, it's the arts and sciences of dentistry. The arts and sciences of dentistry, okay? The arts and sciences of endodontics. You need to know your sciences. Microbiology, biology. You need to know this stuff. If you don't know this stuff, you need to know immunology. If you're weak, if your sciences are weak, your dentistry is weak. Okay, so let's talk about an example that we had today and I posted today. The question was, we had a patient and the patient had trauma and there was resorption. And the idea was, can we just go ahead and monitor this tooth and not do anything? And again, as I said, I'm not trying to put anybody down. My purpose is to educate. Okay, so the arts and sciences of endodontics here, I'm talking specifically about endodontics, okay? So there's trauma to a tooth, and a few weeks, a few months later, patient comes to you and you see on your x-ray, on your PA, on your x-ray, you see that there's resorption. Can you go ahead and just monitor this tooth? See, that's why it's important to know the sciences part of dentistry, the sciences parts of endodontics. If you don't know the sciences part of endodontics, your patient will suffer, and ultimately you will suffer because you will be blamed for what you did. What happens when there's trauma and what has happened when you see resorption and what kinds of resorption do we have. So you need to know those things. You need to know the sciences, the biology, the microbiology, immunology, what happens when there is trauma, and what kinds of resorptions do we have, and what is the treatment? Is the treatment monitoring the tooth when you see resorption on your x-ray? Again, if your sciences part is weak, then you will suffer and your patient will suffer more importantly. And I'm going to simplify this, okay? And I'm going to simplify it. So when you have trauma to a tooth and you see resorption, let's say you see external resorption. All right. What's happened here? What's the science behind this? Well, you have cells. You have different types of cells on the surface of the root. Okay? These cells communicate with the immune cells. So the body, the immune cells, know that this is your tooth. Again, if you don't know the science, the patient will suffer. Okay, so now what's happened here if you have external inflammatory root resorption or any type of external? We're talking about external. I'm going to cover internal next. Okay, so what happens in this case? Well, some of the cells on the surface of the root, so when there was trauma to this tooth, some of these cells that communicate with the immune cells have died. Now, when the immune cell, again, I'm simplifying it, when the immune cells say hello, and there's a way, it's like the gangs, there's a specific way that they shake hands and they know they belong to each other. Same thing with these cells and the immune system. There is a specific way that these cells say hi to the immune cells and back. So they need to recognize each other. When there's trauma to the tooth, some of these cells on the root surface die. So when the immune cells and they say hello to each other constantly and hello back. Constantly, this is happening constantly. So when the immune cells say hello, they don't hear a hello back because some of the cells here have died. So now suddenly the immune cells say, this we don't recognize this thing being the tooth now. So they start destroying it. And that's why you get the external resorption, because the immune cells are attacking this tooth because they don't recognize part of the tooth that can't say hello back to them. So now, what if you have internal inflammatory resorption? Again, when there's trauma to the tooth, now the nerve tissue has become traumatized. Now you have circulation, right? Blood circulation, immune cells coming in. And again, you have some of the cells now, the pulp cells, the pulp tissue cells have died because of the trauma, trauma have died. And now they can't say hello to the immune cells within the pulp tissue. So what happens? Now you see internal inflammatory resorption. Again, if you don't know the sciences, the patient will suffer. What good does that do if you don't remove the pulp tissue? And if you don't remove this inflamed pulp tissue from inside of the tooth, what will happen to the resorption? If you monitor, say, I'm going to monitor this tooth, you see the signs of resorption, be it external or internal. You see the signs of resorption and you say, I'm just going to monitor this tooth. Well, it's very likely the next time patient comes in, there is not much tooth left because the inflammatory resorption does not stop, or it very, very rarely stops. The body, the immune cells continue to destroy this tooth because they don't recognize parts of it and they continue just eating away at it, rejecting it. So you not knowing the science and not going in right away to do endo to remove this inflamed pulp tissue from inside of the tooth caused the patient to suffer. This patient, maybe this tooth 6 months ago when you first recognized the resorption could have been saved, but now because you monitored the tooth, you didn't do anything, you just monitored because you didn't know the sciences. You didn't know the sciences. Now the patient is going to lose this tooth. Sometimes this external inflammatory root resorption happens because the source of what's irritating the immune cells is the pulp tissue. So the inflammatory cells are attacking this tooth this way, and to some degree maybe within the pulp tissue as well, but they're attacking it this way also. They want to get to the inside. They want to get to the pulp. This is the area where the problem is. So they're resorbing. They're eating away at the root of the tooth to get to the inside, to attack the pulp tissue. So what happens if you just monitor this tooth? You will continue, the immune cells continue to destroy this tooth. So again, you not knowing the science has caused this patient to suffer. The patient, you monitor, you say, I'm going to monitor the tooth. So in 6 months, in a year, when you see the patient, this tooth is very likely gone. So as soon as you see inflammatory resorption, be it external or internal, you need to remove the pulp tissue. You need to do a root canal. And you need to tell the patient, sometimes you do a root canal and maybe the immune cells, the immune system stops eating away at your tooth. But sometimes you do the root canal, but the immune system, your body's immune system continues to eat away at the tooth. We're going to do the root canal and we'll see what happens. But you tell the patient, don't keep your hopes up. We'll do our best and see what happens. But you not doing anything. You're saying, I'm going to monitor this tooth. This tooth is gone. So you didn't even give this tooth. So you monitoring this tooth, saying, we're going to monitor it, instead of doing the root canal right away to remove this pulp tissue that's causing all of this. You're saying, we're going to monitor this tooth. This tooth is doomed. So you not knowing the sciences caused this patient to lose this tooth. See what I mean? The arts and sciences of dentistry. You need to know the sciences. If you don't know the sciences, if you don't know the etiology, the cause of everything, if your biology, microbiology, immunology, and recognizing the etiology of disease and how to treat it is weak, the patient will suffer. You guys need to go read up. A lot of you guys don't know the sciences. You don't know it. You're just after, and I'm an endodontist, so I'm talking to you about endo right now. So you're just after that white line at the end. You're just the thrill of obturation. That's what you're after. You have no idea what you're doing. You're just after those pretty white lines at the end. You don't know what you're doing. You don't know the biology, microbiology, chemistry, immunology. You're just after those pretty white lines at the end, those lateral canals. Well, how do I get the lateral canals? How do I get the puffs, sealer puffs? Dude, come on, man. Strengthen your sciences, man. Go read up. Go study. And I want you guys to message me and tell me, be honest, and tell me that you knew what I was talking about. You knew the microbiology, you knew the biology, you knew the immunology, you knew the etiology of what we talked about. Or you didn't know it. I want you to be honest. If you didn't know it, I want you to text me and say, Message me and say, I didn't know it. I appreciate it. Thank you. I know a lot of you guys didn't know what I was talking about. I know a lot of endodontists who don't know this stuff. So even if you're an endodontist and you didn't know, and I taught you something today, I want you to message me and tell me that, hey, I appreciate it, I didn't know. If you're a general dentist, I want you to message me and tell me, hey, thank you, I appreciate it, I didn't know. Let's see who's honest. Class dismissed.